If I asked you what the leading cause of cancer death is, your answer would probably be breast cancer or colon cancer, maybe prostate cancer. But here's what most people don't know. There is a type of cancer that kills more people than all of those three that I mentioned before combined in the US and is the #1 cancer killer in the world. It's lung cancer. And it's not just in smokers anymore. Lung cancer is increasing in never smokers, particularly in young women, at unprecedented rates, and we don't know why. My name is Andrea Stefani. I am a biochemist and the CEO and co-founder of OncoSwab, a biotech startup focused on making lung cancer detection easy and accessible for everyone. And today, I'm going to tell you about lung cancer, why it's the top cancer killer in the world, and what you can do to change that. So let's start with, how does one get diagnosed with lung cancer? Let's say you have persistent cough, the type of cough that just won't go away, that's even weird, anxious, inducing to hear. Same as if you had a lump in your breast, you go to the doctor to get it ruled out, to get the scariest scenario, which is in this case cancer, ruled out. So if you have a lump in your breast, you get a mammogram or an ultrasound. Done, ruled out. However, if you have persistent cough, chances are nobody's gonna rule anything out. You're probably going to be sent home. And honestly, probably it's not cancer at all. Coughing is, at the end, one of the most common symptoms in the world. But what if it is? What if you're a smoker? What if you have family history of lung cancer? What if you have other risk factors? Then you really need to get it checked. And I know this because I went through this firsthand with my mom. She had this really scary, persistent cough that wouldn't go away. It literally gave me anxiety every time I heard it. And I told her, Mom, you need to go to the doctor and get it checked. And at the end of the day, she was a smoker, so I thought that it made sense to rule anything out. I naively thought that this is something that you can simply do. So she does go to the doctor, and here's what the doctor asks. Are you coughing blood? Which, by the way, is a symptom of late-stage lung cancer. And my mom said, no, I'm not coughing blood. And then the doctor said, okay, thank you. Then you can go home. When my mom said this to me, I was like, okay, no way on earth. You're not taking no for an answer. You're going to go back and you're going to advocate for yourself. And she did. Month after month after month of tons of doctor visits, tons of unnecessary tests. Finally, after 15 months, she got a no, you're clean. You don't have lung cancer. After 15 months, over a year of unnecessary procedures, and most importantly, anxiety for her and for her family. It's at that point when I thought to myself, if I want my mom and my loved ones to get screened for the deadliest cancer in the world, this is what they have to go through on a yearly basis. That's not sustainable. There has to be an easier way, and that's exactly what we're building at my company. I'll tell you more about that later. But first, let's understand, why is it so hard to get diagnosed with lung cancer? This is something we need to talk about because the ideal scenario is where everybody gets screened for lung cancer, right? But here's the thing, there is actually lung cancer screening in countries like the US. Do you want to know how you can qualify for lung cancer screening in the US? You have to be between 50 and 80 years old, and you have to have smoked the equivalent of 1 pack of cigarettes a day for 20 years. Imagine, you know what that means? That means that 65% of people that get diagnosed with lung cancer would have never met the guidelines for screening. That means that most people that get diagnosed with lung cancer are doomed to a late diagnosis. But hey, here's the thing. Even if you qualify for lung cancer screening, the solution is a CT scan. I don't know if you've ever gotten a CT scan done, but let me tell you, it's not nice. You'll get this liquid injected in your veins that makes your whole body go warm. Then you're put in this machine for longer than you probably would like to, and you're asked not to move and not to breathe. All of that while being exposed to radiation. We're talking about screening here. That means people that are otherwise healthy, that have no suspicion of cancer or no symptoms. So you're telling me that I need to take some time off work, take my car, drive to wherever the closest imaging facility is, and expose myself to all of that every single year for 30 years when I have literally no symptoms? I don't think so. Maybe that is why less than 20% of Americans that qualify for screening don't get screened. But truth be told, at least it's a form of screening. At least it's a solution. The US is one of very few countries that have lung cancer screening programs. Spain, the country I grew up in where my mom lives, doesn't have lung cancer screening. If that was the case, then maybe my mom's story would have been completely different. But also, maybe not, because you don't have to just be a smoker to qualify. Remember, you have to have smoked a pack a day for 20 years. I don't know if you're still following me here, but essentially all of this chaos explains why most lung cancer cases are detected at later stages. And this is just the surface. This is just the screening part. Then comes what happens after you're suspected of having lung cancer, which again isn't exactly a walk in the park, and the process can take months. And I could make a whole video on that topic alone. So now you understand how lung cancer screening works or doesn't work. Now, the next question would be, why is it so deadly? Why isn't it easy to treat? Like any cancer, lung cancer starts as a mass of tumor cells that start growing uncontrollably and exponentially, particularly in the lungs. Now, the lungs are internal, very resistant organs. So if there is a mass growing uncontrollably in your skin, in your breasts, in your mouth, somewhere else in your testes, you would probably notice. But in your lungs, you may not know until it's too late. And actually, lung cancer on its own is not a death sentence. The average survival rate, the average 5-year survival rate for stage 1 non-small cell lung cancer is 75 to 90%. But the problem is, guess where all of the blood in your body goes to get oxygen? Your lungs. So the longer you wait, the more the tumor grows, the higher the chances of the tumor cells spreading all over your body because of how incredibly irrigated the lungs are. And once that happens, it's very hard to go back. The only solution here, the only real alternative we have to change the #1 cancer killer in the world is to make early detection the norm. And that's exactly why we started OncoSwab. Picture this. Imagine if you could detect lung cancer using nothing but a nasal swab. The entire world has been trained to do this one thing, putting a swab up in our noses. And if there's anything that COVID taught us, is that if a test is quick, easy, and inexpensive to do, adoption will be huge. So why let the momentum die? Why not use this approach to diagnose and detect other diseases? So with my background in biochemistry and my team's expertise in lung cancer, the clinical aspect, and biotechnology and molecular assays, we're building a technology that can detect lung cancer biomarkers directly in the nose, giving us the opportunity to help diagnose patients in a matter of hours. This technology is currently being tested in clinical studies with multiple hospitals and with the support of massive collaborators like the #1 hospital in the world, Mayo Clinic. So imagine if my mom, instead of going through all of that process and all of those doctor visits and all of the healthcare expenses that signifies, could have just taken a nasal swab and know within a matter of potentially days instead of over a year that she was healthy. But even more, what if we make it so simple to detect lung cancer that everybody can get screened? Something like colon cancer, everybody over the age of 50, and make it part of the yearly checkup. That could dramatically change the way we look at lung cancer and potentially many other cancer types too. So what can you do? The biggest and most important thing you can do from your house is talk about lung cancer. Help raise awareness. Share this video, send it to friends and family. Help the lung cancer community tell the world that lung cancer deserves attention, deserves funding, and deserves resources. Look at breast cancer, for example. There are countless events, concerts, races, even planes are going pink to raise awareness for breast cancer. And it worked. It has worked. Awareness has been raised. Now it's time to do the same, but for the type of cancer that claims the lives of almost 2 million people worldwide every single year. It can and it will get better than this, but it depends on us. I hope you like this video. I could talk about lung cancer for literally the rest of my life. If you have any questions or any video ideas, please drop a comment down below. And don't forget to subscribe to follow the journey. If you're curious about how I left it all behind and moved to San Francisco to build this startup, check this video right here. See you in the next video. Bye.